Having a baby is a delightful experience, but it can also have its challenging moments. There's just so much to think about, like which is the best way to feed your baby, breastfeeding, or rather opting for formula milk. Pediatric experts agree, if you're healthy, breastfeeding your baby is still the best option. Why? Because breast milk is a complete food. It provides the best nourishment and is easily digested. It also helps your baby to combat infection. It provides immunity to diseases and prevents allergies. The best reason, perhaps, is that it helps you to bond with your baby. New studies even suggest that breastfeeding can reduce the chances of postpartum depression or baby blues in new moms. It's very important that your baby drinks the colostrum in your very first breast milk. You can give this first feed very soon after birth. Colostrum is a form of milk your body produces in late pregnancy and a few days after you have given birth. Although your first milk won't be plentiful at first, it is packed with nutrients and antibodies to help protect your baby against infection. Colostrum also has a mild laxative effect, which helps to clear your baby's digestive tract and stimulates gut development. Don't worry if you do not yet know how to breastfeed. It may take a while to get used to it, but once you both get the hang of it, it'll all be fine. And don't be afraid to ask your midwife or nurse for help. Because babies can feed for anything from 5 to 40 minutes, it's important to find a comfortable nursing position for both you and your baby. This may take some trial and error. Start by sitting up at about 45 degrees, cradling the baby across your chest, both of you supported by pillows or cushions. This is known as the cradle hold. Make sure your baby latches onto the nipple. While it takes a bit of practice, starting as soon as possible after birth and skin-to-skin contact helps this natural instinct kick in. You know you're doing it right if you feel a tugging sensation and your baby's lips look flanged out. You will notice a few sucks, followed by a pause in breathing when your baby swallows. To add some comfort, use lanolin cream to soothe your nipples and wear disposable breast pads to prevent milk leakage. You will also find that a maternity bra with drop-down cups makes nursing so much easier. Some tenderness is common, but watch out for cracked or bleeding nipples. Speak to your doctor or nurse if this happens to you, or if your baby seems unsatisfied while you breastfeed. In the first few days, you will have to feed your baby quite often, perhaps every hour. After a week, this will decrease to once every couple of hours, or 8 to 12 times a day. As your baby grows, the time between feeds will get longer as your baby drinks more and more. You can tell if your baby is getting enough milk by monitoring the number of wet and dirty nappies. For newborns, a week after birth, this is at least 6 wet diapers and 3 stools per day. Weight gain is another sign that your baby gets adequate milk. Look out for any signs that your baby is hungry, from the licking and smacking of lips to the sucking hands and fingers, and of course, crying. Remember that your baby absorbs small amounts of whatever you eat and drink through your milk. It's best to avoid caffeine and alcohol and limit your consumption of oily fish and citrus fruits. Most importantly, don't smoke while you are breastfeeding. If you're healthy and eating a well-balanced diet, you should be able to provide your baby with plenty of breast milk. Feeding on demand can also help to increase your milk supply. The more your baby drinks, the more milk you'll produce. If you feel that your baby is not getting enough to drink, talk to your doctor or nurse about formula milk. You may have to supplement your breast milk or completely substitute breast milk with formula milk, but that's okay too. You can express breast milk to bottle feed your baby. For example, if you've gone back to work and someone else looks after your baby, or if you battle to breastfeed. Use a manual or electric pump to express into feeding bottles and store it in the refrigerator. Remember, every baby is unique. Whether breast or formula fed, the most important thing is that your baby is happy and growing. For more information and support on this and other topics relevant to your life stage, register for the online HealthPrint program today.